About 130,000 Canadians contract shingles every year, and about a tenth of them will develop lingering nerve pain. That's why many seniors, healthcare professionals, and advocacy groups are pushing vaccination and calling on Alberta's government to publicly fund that shot. Tim Brooke has more on coverage for the viral infection and those most impacted.
The shingles vaccine is a hot commodity at the medicine shop pharmacy.
And typically it's somebody will have an experience with a friend or a family member that had shingles and it was quite terrible, and they'll spread the word.
The skin infection is a rash caused by the same virus that causes chickenpox. Some liken symptoms to burning electrical shocks on their skin or needle pricks. So this vaccine is very important. There's just one problem.
There are some people that can't afford it.
One dose costs about $198, and older Canadians need two. Currently, the vaccine is publicly funded for adults of varying ages in Ontario, Quebec, PEI, and Yukon. And starting next month, Newfoundland will also offer the shot for free. But not here.
You know, we haven't been the first province to pick up coverage on vaccines in history.
It's a tough expense for an age group largely on a fixed income.
That's a lot of money for the money that they get in. Still has to pay their rent, their food, everything else.
Seniors tell us they understand the vaccine's value, but still scoff at the lack of provincial coverage.
I think it's very cheap of them. From what I've seen of shingles, I think it's very important to have.
The Minister of Health would not give us an interview, but her office did send a statement saying Alberta Health considers several factors when determining vaccine funding. The ministry points out that while the vaccine is safe and effective, shingles itself is not highly contagious. Advocates believe that's no excuse.
Keeping our healthcare system flowing and getting rid of hallway medicine means investing a very little bit of money up front on vaccines to save millions of dollars downstream.
The National Advisory Committee on Immunization recommends every Canadian 50 and up receive a shingles vaccine. Tim Brooke, CTV News, Calgary.
The province does provide the shingles vaccine at no cost to solid organ transplant patients over the age of 18. As of now, there are no plans to expand that coverage.